Hi guys! Welcome to the Brainy Buzz channel. So before we get started, make sure to hit the like button, also subscribe to my channel. 10 important body signs you shouldn't ignore. So make sure to watch the full video. 1. Chest pain or discomfort in the upper body. Unlike the movies, most people with a heart attack don't suddenly fall to the ground clutching their chest. Symptoms often come on slowly, and people may describe an uncomfortable pressure, squeezing, or pain in the center of the chest that lasts a few minutes or goes away and comes back again. Sometimes the symptoms are felt more in the neck or in an arm. Women may be more likely to experience symptoms such as nausea or vomiting, back or jaw pain, or shortness of breath. It is not uncommon for people suffering from a heart attack to break out into a cold sweat. A heart attack is a circulatory problem, and it is different from a cardiac arrest, although the two terms are sometimes mistakenly used interchangeably. In a cardiac arrest, a person is more likely to suddenly fall to the ground because the heart suddenly stops beating or starts beating abnormally. A defibrillator is needed to get it beating again, and hands-only CPR should be performed to the beat of staying alive until emergency services arrive. 2. The worst headache of your life. Almost 1/2 of the world's population has some type of headache disorder. That's a lot of headaches, and trying to sort out dangerous headaches from minor headaches is a challenge faced by physicians every day. But there are a few red flags or warning signs that should be taken seriously, even if you suffer from headaches regularly. Call 911 or go to the ED if anybody describes their headache as the worst headache of my life, or if their headache is accompanied by other symptoms such as neck stiffness, personality changes, or a loss in function of just one area of the body, such as an eyelid drooping, speech or balance difficulties. 3. Drooping or weakness down one side of the body. Every year, about 795,000 Americans suffer a new or recurrent stroke. That's about one stroke every 40 seconds. A person's chances of survival after a stroke are greatly improved if somebody recognizes their symptoms quickly. FASD is an easy way to remember the sudden signs of stroke. F. Face drooping. Does one side of the face droop or feel numb? Is the person's smile uneven? A. Arm weakness. Is one arm weak or numb? Does one arm drift downward when both are raised? S. Speech difficulty. Is speech slurred? Can they correctly repeat a simple sentence like "the sky is blue"? T. Time to call 911. Note the time and get help fast as someone shows any of these symptoms. 4. Shortness of breath or wheezing. Many different conditions can affect your breathing. Although most causes are not dangerous and are easily treated, if the breathing difficulty is new or getting worse, it may be a sign of something more serious. Call 911 if somebody stops breathing, is having serious difficulty breathing, or if their breathing difficulty has come on suddenly. Urgent attention is also warranted in people with a known condition, such as asthma, whose usual reliever medications, such as albuterol, are not helping, or in people with chest discomfort accompanied by shortness of breath. 5. Weight loss with no good reason. Weight loss is to be celebrated if you have been working out every day, eating healthily to try and lose weight, or following a specific diet. But if you are just sitting around, not doing much, eating what you normally eat, but your weight seems to be falling off, get it checked out. Unexplained weight loss could be a sign of stress, depression, infection, cancer, a digestive disorder, or a side effect of some medications, such as fluoxetine or levothyroxine. 6. Pain in your abdomen that persists or recurs. Here are many different conditions, some serious, others not so serious, that cause stomach pain. Less serious causes include constipation, food allergies or intolerances, food poisoning, indigestion, irritable bowel syndrome, and stomach viruses. More serious causes include appendicitis, bowel obstruction, cancer, stomach ulcers, inflammatory bowel disorders, Crohn's disease or ulcerative colitis, and kidney stones. Bear in mind that how bad your pain is does not always reflect the seriousness of the condition causing the pain. For example, a stomach infection can cause severe stomach cramps, whereas colon cancer or early appendicitis may only cause mild pain or no pain. See your doctor if your abdominal pain persists or recurs. 7. Tenderness, pain, or swelling in one or both legs. Almost all types of pain, swelling, or tenderness in the lower limbs needs to be investigated further by a doctor. However, causes vary greatly in urgency and severity. Generally, symptoms that come on suddenly occur just in one leg, or that are accompanied by chest pain, difficulty breathing, or confusion warrant a visit to the ED, as they may be a sign of a blood clot, such as a DVT or a heart condition. If the swelling or pain has come on, gradually see your doctor as soon as you can. Common causes include arthritis, drug side effects, heart failure, injury, kidney problems, poor circulation, or pregnancy. 8. Blood mixed with feces in the urine or non-menstrual bleeding. Blood occurring in places where or when it shouldn't is always a warning sign. Blood on or mixed in ear stool can occur with hemorrhoids, anal fissures, stomach ulcers, inflammatory bowel disease, and colorectal cancer. Bright red blood usually indicates bleeding near the rectum, whereas dark or tar-like blood mixed in with the stool indicates bleeding higher up in the colon or small bowel. Blood in the urine may turn toilet water red or pink. It may be a sign of a kidney, urinary tract, or prostate problem, or occasionally the result of a bleeding disorder. Bleeding in postmenopausal women or constant bleeding in women of childbearing age always warrants further investigation. Causes include fibroids, hormonal medication, such as estrogens, inflammation or infection of the cervix, ectopic pregnancy, or cancer. 9. Feeling like there is no point. Depression is very common, affecting 1 in 10 Americans. Left untreated, it can cause a downward spiral of worsening mood that can be hard to pull yourself out of. Symptoms include feelings of hopelessness or helplessness, self-loathing, loss of motivation or interest for activities that you once loved doing, appetite or weight changes, sleep disturbances, feeling tired all the time, and reckless behavior. If you ever feel like there is no light at the end of the tunnel, and death feels like the easiest end to your pain, help is just a phone call away. The National Suicide Prevention Lifeline, 1-800-273-TALK, is toll-free and available 24/7 with skilled, trained counselors ready to help you find a reason for living. 10. A new spot on your skin or a spot that looks different from others. New spots that have changed in size, shape, and color may be a sign of skin cancer. During a self-exam, look for moles by following the Abde rule and check for asymmetry, border color, diameter, and involvement of the mole. What do you think of our video? Let me know in the comment section below. If you enjoyed this video, make sure to hit that like button. Also subscribe to our channel before you go.